chronic inflammation. If you can control the inflammation levels in your body, you can control your health. In this video, I'm going to simplify and show you how to lower the inflammation levels in your body so you can instantly improve your health. It doesn't matter what you're trying to heal from. If you're trying to reduce your level of pain, if you're trying to increase your energy, your digestion, if you have chronic systemic inflammation, you will not heal well, nor will you feel well. My name is Dr. Jon Saunders, and in this video, I hope to take a complex topic like systemic inflammation, bring it down, simplify it, and allow you to walk through some steps that's going to instantly allow you to change the level of inflammation in your body so you can function, feel, and heal much better. This is a video I encourage you to save, bookmark it, share it with someone you care about. I really believe the information I'm going to cover can be life-changing. So what is inflammation? Let's keep this simple. There are two types of inflammation. We have acute inflammation and chronic or systemic or silent inflammation. How do you know if you have this type of inflammation? Well, there's a few cardinal signs and symptoms. Things like widespread body pain. Maybe you are achy. Maybe you have multiple joints that are achy. Your muscles are fatigued. They're sore when you press on them. This can be an indication that you have systemic or silent inflammation. Other symptoms such as chronic fatigue, insomnia, digestive issues, these also can suggest that your inflammation levels are way too high. Even mood disorders like depression and anxiety can be signs of high inflammation in your body. Where does chronic inflammation or silent inflammation come from? Poor dietary choices. Let's address the diet first. One thing I can tell you with treating thousands of patients, one thing is certain, is that most people will fail to heal, to reach a goal, because they don't do what's necessary for a long enough period of time. So the number one thing you can do to increase your chance of being successful with an anti-inflammatory diet is be consistent. Make it automatic. Be consistent. Push through that barrier. Once you get to the other side and once you start to notice some changes, this is where your life can be transformed. Change your diet by addition, not subtraction. So don't say, I'm going to not eat any of this stuff, because you're setting yourself up for failure. One of the easiest things you can do is add in good stuff. I'm going to help you with that. I'm going to provide a anti-inflammatory shopping list for you in the description below that you can take, and you can start to add these foods into your life rather than subtracting other foods out. It's a change in how you think about food. Instead of trying to deprive yourself of the foods you love, we're going to add some good ones in, and as you add those in, you're going to start to feel better, and it's going to cause you some momentum to pull some of those foods out that you know are not healthy for you. The other thing I'm going to leave in the description below for you is a meal planner. If you fail to plan, you will not be successful. I can tell you, if you go to your fridge when you're hungry and you open it up, the first thing you're going to grab is the easiest, most processed, probably the unhealthiest thing you can grab from the fridge. You need to plan that in advance. I like to plan my week in advance, right down from breakfast, snacks, lunch. Even if I'm going to go out for dinner, I try to plan what I'm going to have before getting to the restaurant. These are easy steps that can be done consistently that will help you achieve your level of lowering your systemic inflammation so you can feel and function much better. The moment you start to add some good foods to your diet, you will, over a period of time, start to feel and function better. This is when we want to reduce or eliminate some foods. There are 5 things I want you to focus on in reducing or eliminating over a period of time as you start to build some momentum in your new dietary or lifestyle changes. First are the whites, the flours, the sugars, the refined carbohydrates. We know where they are. Those whites will literally start to change to sugar the moment your tongue touches them and they start to be digested. These whites will devastate your attempts and increase your inflammation levels instantly. Number 2, juices and sodas. Let's stick to water. Let's stick to some teas. Even coffee is better than juice. Juice are empty sugar calories, as are any sweet drink that has sugars or high fructose corn syrup. These are things we want to avoid. Number 3, processed foods. Anything that comes in a box with an expiry date, try to minimize or eliminate that completely. Let's stay to the fresh foods. Let's stay to those foods that will expire if we leave them in the fridge long enough. Number 4, dairy. Dairy can be devastating to our inflammation levels. This is a tough one. Many people like milks and cheeses. We're going to start with reducing those intakes. And finally, trans fats. These are fats that are not found in nature. They're processed fat. Alternative to trans fats would be things like olive oil, coconut oil, ghee, stuff like this. Even butter is at least more natural. Let's eliminate our trans fats. Okay, so let's not be overwhelmed. Remember, down below in the description, there is a grocery shopping list to help you start to add in good foods while you start to eliminate or reduce those bad foods. The next thing we want to talk about are supplements. The best supplement would be no supplement. What I mean by that is it would be great and amazing if we could take all the necessary essential nutrients in by the food that we take, but based on our lifestyles today, based on the nutrient deficient food that we eat, the food that has been processed, unfortunately today, in this day and age, we need to supplement. Our focus for lowering your inflammation levels will be to focus on our essential nutrients. Essential nutrients that we're deficient in must be supplemented for. So the first essential nutrient we're going to talk about are omega-3s. The human body is genetically designed to absorb a ratio of omega-3 to 6 of 1 to 1. Unfortunately, in today's diet, that ratio is as high as 20 to 1. This creates a massive amount of inflammation in the body that is detrimental and devastating to our health. So where do we get these essential fatty acids? Typically, we get these in fatty fish, things like sardines, mackerel, salmon, in the form of an EPA, DHA type fat. We can also get these essential fats in plants through ALA, in things like flax, chia, kale, broccoli. The tough part with getting it through ALA through plants, it's almost impossible to get the amount necessary to sustain human health and to keep our inflammation levels low. So chronic excessive pain, fatigue, painful joints and muscles, eczema, dry skin, hair loss, heart problems, memory problems, even mood swings and depression can all be caused by a deficiency in omega-3s. Various studies have shown that supplementing with omega-3 fatty acids in the right ratio in a natural form can lower our inflammation levels. You want to make sure that first your supplement you're choosing is devoid of toxicities, it's purified. We also want to make sure that that omega-3 is as close to nature has provided in terms of its ratio of omega-3 to omega-6 fatty acids. We want a daily intake of EPA to DHA at approximately 370 milligrams per day for EPA, whereas the DHA daily intake should be about 240 milligrams per 40 pounds of body weight or 18 kilograms. We also want to always make sure that we're taking these in as the body was designed to take them in, and that is with food. So make sure you're taking omega-3s with food. And as always, speak to your healthcare provider because there are some contraindications. If you are on blood thinners or taking a daily aspirin, please speak to your doctor if omega-3 supplementation is okay for you. Vitamin D3. The simple fact that humans were designed to get their sufficient amounts of vitamin D through sun exposure is key to understanding the reason why we need to supplement with vitamin D3. Approximately 10% of our vitamin D levels come from food, so it's essential to either get sunlight, at least 15 to 20 minutes of exposed face, arms, and legs per day. However, if you live in Canada like me, that is not possible in the winter, so we definitely need to supplement with vitamin D3. We need to make sure that the vitamin D3 is suspended in an oil that's healthy. So you want something like an organic olive oil or a coconut oil base. So vitamin D is actually a hormone. It regulates cell growth. It helps in the immune system function. It's involved in neuromuscular action. And what we're talking about today, it is a regulator of inflammation in our bodies. Oftentimes, I'll have conversations with patients that will say, well, their vitamin D levels are low, the blood shows it, they try to supplement for a bit, and it never raised their levels. Well, in certain circumstances, you may need sunlight to do that. But under normal circumstances, oftentimes the case is why they were unsuccessful in raising their vitamin D3 levels is A, they took a poor choice in supplement. The supplement was highly processed and the body was just not able to absorb it. And or they didn't take enough long enough. And so getting to the dosage, again, you want to speak to your healthcare provider for this, but the general rule is this. You can take up to about 1,000 IUs per day per 40 pounds of body weight. For kids, they can take between 1,000 and 2,000 very, very safely. But for an adult, if you are deficient, you might need to take the higher end of that in order to get your levels up to make sure your body can function and heal the way it's designed to. There are some contraindications. Again, this warrants a conversation with your pharmacist or your healthcare provider. If you have sarcoidosis, if you have high phosphate or calcium in your blood, if you're prone to kidney stones or have kidney disease, please speak to your doctor before supplementing with vitamin D3. Probiotics. We are consuming about 1 million of healthy probiotics that we did before pesticides, herbicides, and industrial farming. This has devastated the normal flora in our gastrointestinal tract. Add in the addition of stress, antibiotics, certain drugs, we have wiped out our normal flora, creating in high levels of body inflammation. Our diets have changed. We're eating less fruits and vegetables, less fiber, which is essential to a healthy gut flora, as they serve as prebiotics or food to the normal flora and our GI tract. So due to all of these reasons, we need to supplement with probiotics. We need to find a good quality probiotic and make sure we're supplementing with enough. We need to be supplementing with 15 to 30 billion per day, every single day. And ideally, if you can, you'll take them with some raw fruits and raw vegetables, as they serve as prebiotics to the supplementation to help restore our normal gut flora. Where can you find naturally occurring probiotics? Well, first let's start with the prebiotics. Make sure you're eating lots of raw fruits, vegetables, and fiber. To get a really good natural source of probiotics, think more sauerkraut, more naturally occurring yogurts with very little sugar. Kimchi is another good source. But again, this would have to be done consistently every day in order to get your levels to where they need to be and to keep things balanced in your GI tract. There are contraindications. Please speak to your health provider or pharmacist if you are immunocompromised and or on certain drugs that may be altered by taking probiotics. So we're almost to the end here. Stick with me. I got 4 more tips to help you lower your inflammation levels naturally so you can function, feel, and heal better. Magnesium. If you are deficient in magnesium, you will be in a pro-inflammatory state. Again, this might be something you'd consider supplementing with to help lower inflammation levels. What could cause you to be deficient in magnesium? Lots of things. Alcohol use, diabetes, certain medications, celiac disease, malnutrition, pancreatitis, and even excessive sweating. If you exercise a lot, this could cause a deficiency in magnesium levels. Exercise. I can never get through a video without discussing exercise. If you are movement deficient, your body is designed to move. If you are not moving enough because you're behind your computer or you're out of an exercise routine, implement some form of exercise. For some of you, it might be a walk. For others, it might be getting back on your treadmill. Whatever it is, just move more. Take more steps. Add 2,500 steps a day to your life. And I can tell you, if you increase your exercise and your movements, you will decrease your inflammation levels. Sleep. If you are not sleeping well, you need to form a routine that's going to allow you to sleep more deeply and longer. If you are sleep deprived because of stress or anxiety, you need to find ways to calm yourself before you sleep, because if you are sleep deprived, guess what? Your inflammation levels rise as well. Sleep better, lower your inflammation level, and increase your health. And finally, water intake. What is your water intake? Do you drink water? Remember how we talked at the beginning of this video, eliminate soft drinks and juice. Well, swap that out with water and teas. We want more water, more hydration. More hydration will decrease your inflammation level. If you decrease your inflammation level, we've talked about this all through this video, you will function, feel, and heal better, and your life will improve instantly. I really hope you found that useful. I really believe that this is a video that you should go back to, save it, share it with family or friends, and of course, if you liked it, I'd appreciate it if you give me the thumbs up. As always, if you have a question, put it below, and I'll do my best to get back to you as soon as possible. Use the resources that I have in the description below to help you change the level of inflammation in your body and allow you to function and feel better than you are today. And if you haven't already, maybe you'll consider hitting the subscribe button below and the notification bell so you can be informed when I upload a new video. I can't wait to see you in my next video. Until then, stay well.